Welcome and thanks for joining us. My guest today is Kimberly Harris, the Director of Community Health and Social Impact at CareFirst BlueCross BlueShield. And Kimberly, this is the second time we've spoken. Very good to see you again. If you could please start off by just giving us an overview of the work you do at CareFirst.
Nick, it's good to see you again. As you mentioned, I'm the Director for Community Health and Social Impact, and I oversee our charitable contributions program for the region, but more specifically the National Capital Area. And that means we look at areas to increase access to care. Mm-hmm. We also address the social drivers of health, and we're really embedded in the community through our associate engagement work that we do. So addressing access to care, affordability, as well as social drivers of health and associate engagement.
And you mentioned a couple times there the term social driver of health. Can you describe exactly what that means? Social driver of health. I suppose you could assume that maybe it means some things in the community that lead to certain health outcomes. I mean, that's what it sounds like, right? Can you describe exactly what that means?
Absolutely. And you probably have heard it as social determinants of health, but we're shifting to drivers because determinant seems imminent. Like there's nothing that you can do to change this. And there are societal and environmental factors that we can adjust as we do interventions and provide education and access to care and address those social drivers, which is basically the non-clinical factors that impact overall health. So when you think about educational opportunities or economic inclusion, those are some of the drivers. Transportation has been a barrier to care. So those non-clinical factors that are barriers to care are what we call social determinants or social drivers.
And when you talk about the non-clinical aspects of all of this, do you have any that are, you mentioned a few, but do you have any that are really the most significant in your mind? You know, when you think about the non-clinical part of it, what's really the most significant, the most interesting perhaps in our community, in the DC area?
So definitely data-driven, and when we look at the region, for example, Prince George's County, health literacy is high at the top of the list in terms of need in Prince George's County. The same thing is true for increased access to healthy food, so food insecurity is high on the list as well. For DC, similarly, we face issues with access to primary care providers, or we might have access to those providers, but they're not distributed evenly across the city. So those are some of the things that bubble to the top. For the region, homelessness is high on the list, and those are all things that we're working to address this year and in 2024. The
healthy access to food part, that sounds interesting to me, because you might have access to food, obviously, but if it's not good for you, it could work against you, right? Exactly.
And I'm sure you've heard the term food deserts, where there's not any access to healthy food, or food swamps where it's inundated with not so good for you food. So you see the fast food and all of that. We've had an investment over the last year or two, actually, with the Nationals, and we work with building bridges across the river. We have a given garden. So the next time you're at the National Stadium, there's a garden at the top of the stadium, and that produce goes to a farmer's market in Ward 7 and 8 to help address some of those food insecurities.
Would you say you have concerns about barriers our communities in the area face when it comes to health and wellness? We're talking now about a few of those, right? A few of those challenges, a few of those barriers. What do you think when you think about the obstacles that people have to go through to get good access to things that'll help with their health and wellness? What gives you the greatest concern? What are some of the biggest barriers, you think?
I think the biggest one, because it's more invisible when we talk about health equity and the racial disparities as it relates to healthcare, that is something that is sort of a moving target, if you will. Like, you can't put your finger on it all of the time, but when we talk about systemic racism, or where we might even have services and how those services are rolled out, maternal health in terms of the disparities with women of color versus women that are not of color, and health outcomes related to childbirth, et cetera. So I think health equity is at the top of the list for
Okay.
me, well, it would be more of the racial inequities that would be at the top of the list, but we're addressing it through health equity. And so Blue Cross Blue Shield Association has health equity as a strategy for all of the Blue Cross Blue Shield plans, and more specifically, CareFirst is participating in that. So looking at maternal health, looking at diabetes, as well as cardiovascular disease, and those kinds of things to really be intentional about the work that we're doing when we see those high disparities as it relates to the inequities.
And when you look at what you do with CareFirst, we have in the past talked about how CareFirst distributes grants, including $8 million to community-based organizations for efforts to improve behavioral health.
Yeah.
And then I think last time you were here, we talked about more than $2 million in grants to small businesses and diverse nonprofits. And that's part of your focus on economic inclusion and development in the area. So we know about the grants that CareFirst is involved with distributing in the community. So how about, from your perspective, when you look at the investments made, what are some of the impacts, would you say, in the community that have come about because of the investments?
I'm super excited about the behavioral health grants, and behavioral health is also on that health equity strategy that I mentioned to you. We are in the second year of the behavioral health grants, and they were designed to do two things. One, increase access to services for youth specifically. And we know that the demand for behavioral health services has increased significantly, especially post-pandemic. So looking at those youth who live in rural areas, those youth who live in urban areas, who have been involved in the juvenile justice system, as well as LGBTQ+. We have a partnership with Smile in the city that works with LGBTQ+ youth and providing that peer-to-peer support. So that was really exciting to be able to be a part of what was needed the most, especially post-pandemic and especially for our youth. So the first half of the grant, or the first prong of the grant, is to increase access to those services for the youth that I mentioned. And then the second piece was really supporting the workforce. And we know that there's health professional shortage areas across our region, but specifically in the District of Columbia. And so being able to help with recruitment and retention efforts for behavioral health professionals was exactly what was needed for the city. And so I'm glad that CareFirst was aligned in that effort and really looking at it from a lens to support not only providing the services, but also recruitment and retention of the staff that we need.
And this is no small amount of money we're talking about. CareFirst giving these grants out to organizations in the community. This is millions of dollars we're talking about. When you partner with an organization and that organization receives a grant from CareFirst, what is the response you get? There must be a lot of gratitude, a lot of excitement, like you said, excitement, right?
Excitement, demand, which is tough when it feels like a lot of money. But when you have a great need and you have so many wonderful organizations that are doing the work, that can be tough. But what I love about it is that everybody has the excitement to meet the goal. And in that case, it was the behavioral health grants. We did the economic inclusion grants that you mentioned, where we're looking at increasing access to capital, as well as capacity building and workforce development for those small nonprofit and businesses. And that was remarkable in the sense of we had so many different kinds of grantees that we provided funding to, from Maryland Latinos Unidos, who provided technical assistance to nonprofits across the region. We worked with Anacostia, Friends of Anacostia Park. That was really exciting because we're able to not only beautify the city through Anacostia Park and the offerings that they have, but they have a workforce program that they're training residents to work at the park. So not only are we beautifying the space, we're also providing workforce opportunities for residents who live in that area.
And you mentioned some specific causes and some specific organizations there. Tell us why, in general, CareFirst finds it to be important to partner with organizations. CareFirst might be able to do some of these things by itself in the community, but what is the reason CareFirst reaches out and forms partnerships? Can you tell us the importance of that?
Yeah, I think just in general, we are better together. And so when we look at partners and the need to partner, I don't know that we could do it by ourselves. When you look at public-private partnerships and what you might bring to the table versus what, say, the district government may bring, or what a community-based organization can bring, or when we're working with health systems, we all come to the table with a different lens. And so we need all of those to be able to provide a comprehensive approach to address some of the most critical needs in the region. And so I don't think that we could do it alone. I'm glad that we don't have to do it alone. And I just want us to get better at that coordination. I think we have a lot of wonderful organizations across the region and specifically in the city, but we could, improve in terms of how are we coordinating those services to really maximize the resources and the impact.
And we have a new year here, 2024. What would you say some of your main priorities are for the new year? What are you working on, and what gets you excited about 2024?
I am excited about a whole lot of things, and excited where we've come, so far as well. But for 2024, we are going to be releasing a new opportunity for funding for diabetes. That's a part of, the second round that we provided. I guess it's been about 2 years now, so we're going to provide phase 2 for that. We're working on maternal health, as I mentioned earlier. We're also getting into housing, which marginally we have been into housing, whether we're providing funding to do refurbishments of affordable housing, but looking at ending homelessness, and then also through the continuum and the spectrum of getting to home ownership. So there's different levels there, but with an eye towards really looking at supportive housing to end homelessness. We're working with Path Forward there in Northern Virginia, and there's some other organizations like Greater Washington Community Foundation. I recently just joined their homelessness advisory board to have a partnership with organizations across the region to really take a proactive approach in how we can end homelessness. So really excited about that. And of course, we'll still be doing economic inclusion, but focusing on workforce and looking at how we can support nonprofit ecosystems and entrepreneurship. When we talk about the health of a community, wealth is a part of that. We know zip code is an indicator of overall health, and we have to pour money back into communities so we don't have food deserts or swamps. And then the life expectancy should not have a gap of 8 years or so with not a large footprint in terms of mileage. And so looking at how we can support organizations and communities to bolster their economic stability, and doing that with partners across the region and some new partners like JP Morgan Chase, and folks would say, how's a health insurer involved with the bank? But again, really needing those unique partnerships to begin to see some changes, because what got us here won't get us there, and it can't be the same sort of mechanism to try to address some of these issues.
You mentioned the ending homelessness efforts. That seems like such a daunting thing, ending homelessness. Can you just give us a brief description of what you mean when you say you're trying to end homelessness? Because it really sounds like almost impossible, but obviously you're doing some important things, right? So can you describe what you mean when you say end homelessness?
Nick, nothing's impossible.
That's right, yeah.
That's at least the energy that we have to have. And to your point, it is daunting. What we're seeing in the city specifically is an increase of youth and young adults being homeless. And the same thing is true for elders. And so having a safe place to sleep as the foundation of health. We have done, a few forums and hearing from people that have lived experiences. And one of the things that stuck with me since I've heard it was a woman who actually was homeless, had an opportunity through an organization in DC to get housing. She had been homeless for 17 years. And of course, comorbidities is a part of that, had heart attacks and other ailments based on just living on the street. And this program provided her with hope. And as a result, she is no longer homeless. She got a bachelor's degree. She was able to get a master's degree. And now she's doing peer support to other homeless neighbors, is what she called them. Because she still has that. But what hurt me was that she said, we're about to activate the winter plan for DC. And I was on the street for 17 winters, and I know what it is. And so those are the things that, although impossible it seems, we can't stop trying.
That's an inspiring story. That's really amazing. Looking forward, what would you say your advice would be for businesses and nonprofits that are looking to maybe get in touch with CareFirst to form some of these partnerships we've been talking about? What would your advice be to those businesses and nonprofits out there in the community?
Well, I would say first, please reach out. We have a website, www.carefirst.com/community. You can learn about some of the investments that we have, apply for funding, but also learn more about what the Community Health and Social Impact Department does. And there is also a link there that allows you to get more information. I am very open to meeting new partners and doing things differently. And so certainly they can reach out through that link, and we can set up a call to figure out what we need to do in partnership to address some of these healthcare issues.
All right, great. Thank you as always. Good to see you again. Kimberly Harris, the Director of Community Health and Social Impact at CareFirst BlueCross BlueShield. I'm your moderator, Nick Iannelli. For more on this discussion, visit WTOP.com and search CareFirst.